Let's learn more about endoscopic forehead and brow lift. This procedure means changing shape and position of the eyebrows using endoscope. This is actual operation room and I am performing forehead and brow lift using endoscope. All currently performed forehead and brow lift use endoscope, and I will show how this can help. And let's see what the benefits are. The endoscope passes into the forehead or temple through a small incision of about 1 centimeter, so usually leave no scar. Recovery is fast. The operation time is also short, so that the operation can be completed within an hour. It is not a mechanical pulling operation, but physiologically the brows and forehead elevated. So the result looks very natural, and the effect lasts almost semi-permanently. The purpose of this surgery is that changing the shape and position of the eyebrows. Ultimately, it improves the image of the eye. After surgery, the image of eye becomes softer, brighter, and more youthful. The principle of this surgery is to weaken the force of the muscles, pulling the brows down, and the muscle force of raising eyebrows relatively stronger, so that the brows naturally elevated. So this procedure means the brows go up physiologically, not mechanically. This old lady has low-lying brow position and multiple wrinkles on the forehead and around eyes. This photo is when she was young. She was pretty and lovely. But after eyelid surgery, changed somewhat stronger appearance, and I did brow and forehead lift. This is before and after, and changed softer, younger, and several wrinkles around the eyes and forehead are improved too much. Compare eye image before and after another lady. Please look at brow position and shape if you consider eyelid surgery. We should know what is the best policy to improve eye expression. Many times, eyelid surgery is not recommendable. This periocular surgery includes double eyelid surgery for young person, upper eyelid surgery for aged person, epicantoplasty. Epicantoplasty exposed inner caruncle too much, and another cantolytic procedure to make eye longer. This procedure is very terrible and very dangerous. Many doctors do skin excision above or below the eyebrow. This kind of procedure also should be avoided. During this procedure, I meet several important structures. Some structures should be cut to mobilize the skin, and some other structures should remain intact. Injury to these structures may cause functional problems. In forehead, supraorbital and supratrochlear nerve should be intact to preserve sensation, but muscles around the glabella area should be excised, sometimes partially and sometimes completely, to improve glabella frowning and for brow and forehead elevation. Operation is performed like this. At first, skin incision, and then, without using endoscope, temporal dissection is performed and forehead dissection performed as well. And then I use endoscope. Using this endoscope, temporal dissection and then forehead dissection is done. In this area, muscle modification is the most important procedure. And finally, fixation the forehead and temporal flap and then skin closed. At first, 3 or 5 skin incision is made. If only medial brow elevation is needed, 3 incision is enough. But to elevate the temporal area, I do additional incision in temporal area. This is the range of temporal dissection without using endoscope, and this is the forehead area. In this area, I don't use endoscope. And then, using endoscope, I dissect temporal and forehead area. So, this is the area that needs endoscopic dissection. Temporal area dissection is done first. This is temporal line, its junction between forehead and temple, and there is strong septum-like adhesion structure. Next, inferior temporal septum. There are numerous fine fibrous structures connect superficial and deep fascia. The most anterior to the inferior temporal septum, this is called orbital ligament or temporal ligamentous adhesion. This is a very strong retaining ligament and should be excised. This is a sentinel vein and preserved. During this procedure, facial nerve is frontal branch. It's not visible, but if the dissection is undertaken on undesirable plane, I mean dissection is done too superficially, this motor nerve may be injured. If this nerve is injured, it is terrible. The affected side brow not go up, but depressed more than before surgery. After finishing the temporal dissection, move to forehead area. Here, sensory nerves and 4 muscles are important. At first, the sensory nerve. STN is a supratrochlear nerve, and this nerve provides sensation to the inner side of forehead. SON is supraorbital nerve, more important nerve than supratrochlear nerve. This nerve innervates sensory to remaining forehead and scalp area. Next, very important muscles. I write it in English capital letters COPD. C is the corrugator. It's the strongest, the biggest, and the color is red and the most important muscle among them and should be excised. This muscle pull down brow and cause glabella frowning line. Next, D is depressor supercilii, also cause brow depression and frowning. O is orbicularis oculi muscle. It also has some role in medial brow depression. Finally, P is procerus. This muscle makes horizontal wrinkles on the nasal root. After tissue preservation and cutting procedure to maintain desirable brow position and shape, mobilized tissue is fixed temporarily. I use cortical tunnel method. Make a small tunnel through a bone and fix the tissue to this tunnel with absorbable suture material. Experienced plastic surgeons usually don't use endotime. If your doctor recommends endotime for fixation, may not believe and consider change doctor. This endotime may cause pain, headache, and uncomfortable feeling, but the final result is no difference compared to other methods. In this video, I presented the principle and anatomy around the forehead and temporal area and operative method using endoscope. Thank you.